Hey everyone, today we're going to be talking about neck pain, exactly what it is, causes, and solutions. So let's jump into it. Watching for the first time, my name is Dr. Sandy. I'm practicing chiropractor over 20 years. And if you've been watching my videos for some time, welcome back. I truly appreciate it. Let's jump into it. So first of all, what is neck pain? So we are talking about the top area between the skull, I would say just between the shoulders, just right over here. I actually have a model kind of going into a little bit of detail. So very powerful part of the human spine. So this is your brain sitting here. This is the top area, and you can see it goes below her. And I think we all acknowledge, like, okay, this is obviously important. It holds my head up, but this has the cervical components and specifically the cervical nerves, which are very powerful. And if you think about it, like this is the beginning of that gateway that's coming from the brain and communicating with the body. So very powerful, delicate area, but we're going to go into it. So if we have neck pain, what can that feel like? Well, first, it may feel like a stiffness. It may be hard to move, especially when you're driving. It may spasm. It may lock up. You may feel burning if it gets bad enough. If it gets really intense, you can have a shooting pain or like a shocking pain, electrical pain. So it can be highly uncomfortable. And as that's happening, what you're feeling, again, that's going to affect function. So when I say that to you, if this is not working right, potentially this can go obviously into the skull, the top area, causing things like headaches, dizziness. It can affect your focus and mood, obviously. From there, it may go lower into your arms, hands, and shoulder. If the lower cervical spine, I'm talking like C6, C7, potentially gets compressed, we may have a shooting sensation going into our arms and hands. So it's a very powerful area, but it needs to be taken care of. Now, what are some of the things that can cause this issue to even show up? Why would someone even get neck pain? And I would say one of the biggest ones right now is because we have a ton of people, most of the population right now using computers, whether it's work related, if they're studying, using their phones heavily, and we have people looking down, which is not a natural alignment. It's not natural posture. It's a negative, and that pressure, that breakdown is causing a lot of it. What else can cause this is that if you play sports and you've had an injury, whether now, currently, or in the past, and sports can be any sport you can think of, and it also includes just going to the gym and lifting weights. We have to be very mindful and protect this area, but an old sports injury, a new sports injury can definitely cause neck pain. If you've ever had some kind of trauma with a slip or fall, a car accident, obviously that can affect that as well. And I would say a big one as well is we already know about computers and using that, but a big thing, and I think we're seeing this across the board, is stress. So chronically being worried, upset, just feeling stressed, that constant tension, what we're thinking causes contraction in muscle groups. That can cause that tension to start to misalign this area, causing pain, inflammation. And then again, when that starts to shift, we can start to have things where the nerves are getting pinched off, which is the communication center, which is giving information. So very powerful. So it can affect the nerves, circulation. If you are chronically having neck pain and you may hear some grinding noise, or it's just, again, that restrictive movement, that potentially could be the gateway to further arthritis and breakdown in the spine. The muscles can get imbalanced. Some are getting weaker. It can lead to a really big mess. And then another thing is that sometimes we fall into that belief, well, I'm just getting older and that's the way it should be. But I believe that yes, there will be some changes in the body as we get older, but if we're learning more and more every day that our lifestyle, our choices affect outcomes. And for example, we know now with teeth, with proper dental care, brushing our teeth, flossing, doing all those good things, we can extend the life of teeth. The same thing goes with the spine. We may think, oh, when you hit a certain age, you just break down. It's going to be painful. You just get arthritis. There's nothing you can do about it. That's not accurate. If the spine is maintained, if it's properly aligned, we can slow down degeneration. You can have better function. Muscles are balanced. Circulation is optimized. Nerve flow is obviously optimized as well. So there's a lot we can do to keep this healthy. So don't fall into that trap that, I'm getting older, pain, breakdown. No, you want to take care of yourself, and actually by taking care of yourself as you get older, you can have a good quality of life, but it's based on the choices you're making. So what are things we can do? So what are some of the best stretches for the spine? And I really want to make this video because I know there's a lot of people using computers and their phones. So the best stretch for the spine, I would do this seated, and I would just start with a few seconds, but just simply looking up, because with a computer, what are you doing? You're going forward, your head is forward, the neck muscles are moving forward, very hard on the spine. So I'd say one of the most critical stretches you can practice at least two to three times a day is just you're safe, you're seated, you're looking up. Obviously, make sure you don't feel lightheaded or anything, but you're just going to look up. We usually tell our patients maybe start with 30 seconds. For some patients, that's difficult. We ask them to, reduce the time. For some people, that's too easy. They can increase the time. But, just looking up and down is not going to do much, in my opinion. You want to hold. The power in a stretch is to hold. The muscles you're retraining, the ligaments, the tendons, all those critical structures are learning a new position. It's not just about reps. Obviously, the next one as well would be turning the head. And again, holding, not just doing reps, holding it to the other side. And then the other one as well is that I think this is one of my favorites for the neck, is just doing a stretch where we're going like this. And what you're doing is you're opening up this area. If that's too much for you, you can simply practice doing this. And even if I can recommend, you can do these anywhere. I would be seated if you can, but if you feel comfortable, you can do them standing up. You may even want to look at your technique and look in a mirror and just see how effective that is. But we want to be stretching. Hydration is critical. It's good for the joints. It's obviously good for the muscle tissue, the nerve tissue. So making sure you're drinking water, avoiding caffeinated beverages as always. You may, depending on what you're feeling, and these are kind of general principles, you have to see what works for you. But shooting pain, I usually tell my patients cold patches, cold cloth. If it's really intense, maybe an ice pack. If it's dull, achy, I usually recommend heat, but it depends on the patient. I would advise that person if I see them, and it's a little different for everyone, but general principles: shooting pain, electrical pain should be more ice. Dull, achy, you can try heat, see what works for you. And we always tell our patients, make sure that we're not putting ice or heat directly on the skin. There should be a cloth barrier. And honestly, I would just do like maybe 5-10 minutes, be very conservative, and try that throughout the day. But listen to your body, whether you're stretching, whether you're icing or heating, be mindful. I know some people put heat for like an hour or something. I think that's way too much. 5 to 10 minutes, reevaluate, see how you feel. I'd rather do a lot of reps opposed to just one time, just keeping it there. Another thing, as I said, stress can impact the health of the top spine. So breathing techniques, prayer, meditation, finding mindful ways to relax. Relaxing your system will help with any type of pain you have in the neck, because stress is a big one. We get tense, we get stressed. Literally, the shoulders go up, the neck will tighten. It can go into the jaw. It can be very painful. So learning to relax, yoga, breathing, meditation, prayer, whatever makes you happy, makes you comfortable. Maybe it's just lying down and just in the middle of the day, 10 minutes, or maybe at the end of the day before you go to bed, and just breathing, relaxing. The more you can do that, that will be a benefit, not just for the neck, honestly, for the whole body. Water, I had already mentioned. And then the big one I would say is that if you are chronically suffering, it feels like it's not really going away, and you're kind of looking for a natural solution. You respect that sometimes, in extreme cases, we need medication. Extreme cases, injections, and more extreme would be surgery. But if you're kind of like, I know those options are out there, but I'm looking for a natural way to deal with this, I would highly encourage getting a chiropractic checkup just to see what's going on and just evaluate it, get it professionally evaluated, see what's going on. And if you have any questions whatsoever about a checkup, or someone who could benefit from a checkup, reach out to us. My name is Dr. Sandy. The name of the office is Powerflow Chiropractic. You can call or text us at 905-896-3393. Call, text us at 905-896-3393. Check us out on the web, drbasine.com or gopowerflow.com. Powerflow Chiropractic's also on Instagram. We're all on the major social media platforms. So if you want to learn more about our office, what we're doing, and even if you just have a general question, you can just reach out to us. We're here for you. But be proactive and just realize the decisions you are making today influence your future. You have so much you could do to control your health, control your body, control health outcomes. You are powerful. You need to make those decisions. Don't be passive with your health. Be aggressive. Take action. Do things to take care of yourself, because your quality of life will be much better. So God bless as always. I'm always going to be making tons of information video to help you, and God bless.